Preterm labor is the topic for this video, and preterm labor is essentially defined as having contractions before 37 weeks. So these contractions are going to be causing cervical change, and that cervical change is easily detected, and the contractions will likely lead to a premature delivery of a fetus. Now, the focus of this topic is the treatment of preterm labor, and the licensing exam questions focus a lot on the treatment options. They'll give you a scenario of a woman that's in preterm labor, and they'll say, what is the next step, or what is the appropriate treatment? And there's three main things that you do when a woman is in preterm labor. The first is antibiotics, and antibiotics are used basically to treat Group B streptococci. And this is a common infection, so you will use antibiotics. Which antibiotics you will use? The most common, of course, is penicillin. If a woman is allergic to penicillin, you can use other choices such as clindamycin, erythromycin, if the woman has a penicillin allergy. So what is the next step in treating preterm labor? Well, the next step is very important. It's something called tocolytics. Now, tocolytics are a very important part of licensing exam questions. Tocolytics are basically drugs that stop the uterine contractions. So I'll just erase that. They stop the contractions. And tocolytics, the way you can think of it, is medications that you would give to buy time. So to give, instead of delivering the baby right then and there, to buy time in the sense of maybe about 2 days, but delaying the delivery by 2 days. Now, you might say, well, what is the reason you want to delay it by 2 days? Well, the most important reason is you want to give the third treatment, which is corticosteroids. And when you give corticosteroids, you allow the fetal lungs to mature. So 2 and 3 sort of go hand in hand. You give tocolytics, they buy time, they give you about 2 more days to stop the contractions, and during those 2 days you give the corticosteroids, and that will help build the fetal lungs. And that's very important. To mature the fetal lungs is important because, of course, it will decrease the risk of any neonatal respiratory problems. And the most common corticosteroids used are betamethasone or dexamethasone. So this video, I really wanted to just touch on those 3 basic things during preterm labor, and in particular, really the 3 medications. They're the antibiotics to treat the Group B strep, tocolytics to stop the contractions by time, and then during those 2 days extra that you've prolonged the pregnancy, essentially, you give corticosteroids, which will help mature the fetal lungs. So here's a vignette that kind of illustrates that. A 34-year-old premi-gravid woman at 30 weeks gestation comes to the physician with regular contractions every 6 minutes. Her prenatal course was significant for type 1 diabetes, which she has had for 10 years. Over the course of 1 hour, she continues to contract, and her cervix advances from closed to and long to a fingertip of dilation with some effacement. The patient is started on magnesium sulfate, penicillin, and betamethasone. Which of the following is the most likely side effect of the administration of corticosteroids? So this is a great question. You have a woman who's obviously in preterm labor, as she is only 30 weeks. Then and this patient has given all three things that we discussed. She's been given penicillin to help treat the groupie strep. She's been given magnesium sulfate, and I don't think I mentioned this, but this is a tocolytic. That's the drug that you give to buy time. And then she's given the betamethasone, which is the steroid to help with fetal lung maturity. Now they're saying, what kind of side effect is she going to have because of the steroid? Well, steroids, one of the many side effects of steroids is that they increase the blood sugar, hyperglycemia. Now this patient is already diabetic, so because she's already diabetic, it's going to be a little more difficult to control her blood glucose. So her blood glucose will need to be monitored, and because she's already diabetic and she's getting now a steroid, she will likely have elevated blood glucose, so she will need to be treated with insulin, which of course lowers blood glucose levels. So the appropriate answer to this question is B, increased maternal insulin requirement.